pain before micturition, pain during micturition, pain after the micturition, burning sensation per urethra before micturition, during micturition, after micturition, pain per abdomen, lower abdomen, hematuria. If the urine is mixed with blood, hematuria. If the frequency of urination is increased, if it is associated sometimes with mild fever or fever with chills, and if the urine is very strongly having smell, very strong urine smell, then we should think about all these aspects of urinary tract disorder called Mutra or dysuria. And bacterial urethritis, prostatitis, epididymitis, cystitis. How to do examination and investigation? One is history, then followed by just palpation of the upper abdomen, suprapubic area, palpation of the scrotum, palpation of the urethra, seeing the glands penis, or vaginal examination to rule out any urethritis. Even Bartholin gland infection, balanitis can also cause dysuria. Next one is understanding by one routine CBC followed by urine examination. Urine routine, micro, if possible, if there is infection, urine culture studies. One ultrasound scanning of the KUB, kidney, ureter and bladder. Abdominal ultrasound can also give you some information of cystitis. Normally cystitis is identified by increased wall thickness of the gallbladder, of the urinary bladder. Wall thickness is increased and post-voidal residual urine may be increased, then again and again urine may be going. Normally 40 to 50 ml of residual urine is there. If it is increased, then bladder outlet obstruction, neurogenic bladder can also cause dysuria. Overactive bladder, OAB syndrome. Overactive bladder is due to the anxiety, generalized anxiety disorders, and interstitial cystitis or painful bladder syndrome. Interstitial cystitis is a chronic condition where there is a painful bladder syndrome. Menopause leading to low estrogen level can also cause dysuria in gynecological practice. Regular usage of oral contraceptive pills can also cause this problem. Sometimes we see that E. coli is a commonest organism causing infection of urinary tract. But other than that, chlamydia trachomatis or pseudomonas, human papilloma virus, can also cause this dysuria symptom. So by knowing all these things, now it is high time to understand what are the common medicines available in Ayurveda, in OPD or IPDs, or in specialty practices, in commercial group, industry. Knowing about industry is also very important. Ekamulika drugs like Amrita Sattva, Guduchi Siddha Fanta, Shatavari Churna, Shatavari Grita, Shatavari Swarasa with Madhu, Punarnava Mula, Punarnava Panchanga Kvata, Gokshura Kantaka Kvata, Gokshura Kada, Trunapanchamula. One of the best drug you can remember to practice dysuria is Trunapanchamula. All varied pathology from simple cystitis, urethritis to renal calculi or even the prostatitis, epididymitis, interstitial cystitis. In all conditions, you can practice Trunapanchamulam. Trunapanchamula Siddha Kashaya can be practiced. In the market, it is also available as Mutrala Kvata, Dashamula Kvata, Varana, single drug or Varanadi Kvata, Shuddha Shilajitu Vati, Brahmi Churna, Brahmi, both Centella Asiatica and Bacopa Maneri or Tiktam Mutralam Shotagnam, that can be used. Chandana, Chandanasava, Utira, Ushirasava, Sariva, Sariva Dyasava, Estimadu Fanta. These are very simple Ayurvedic preparations can be used. Yeladi Churna is also having Mutrala and Shotahara effect. One common question Ayurvedic beginner will ask, modern doctors will give antibiotics. Then what is Ayurvedic antibiotics, sir? Yes, definitely it is a good question. All patients who take urinary antibiotics will not respond equally. Someone will improve completely, someone will improve half the way, someone will improve 30%. Someone will get recurrent infection once stop the antibiotic and consume the hetu, and someone are drug resistant, antibiotic resistance. So then there are useful Ayurvedic drugs like Sudarshana Ganavati, Kirata Tikta, Ativisha, Gandhaka Rasayana are equally good drugs. Even Vasanta Kusmakara 1 OD. If you feel early urinary tract infection, premenstrual or menopausal, perimenopausal, postmenopausal, just give 1 tablet of Vasanta Kusmakara Rasa. Patient feels immediately better. Within 1 to 2 hours, patient feels better. Godanti Basma, Shweta Parpati are very effective drugs which will decrease the pain and burning sensation in the urinary system. Godanti Basma 125 to 500 milligram twice a day. Shweta Parpati 125 to 250 milligram 2 times a day. They are available in government Ayurveda dispensaries. Godanti Basma is analgesic, antipyretic, anti-inflammatory. Shweta Parpati is also analgesic, antipyretic. It can be used. And if you want to have a carry home message, Hajrul Yahud Basma is very effective in urinary tract infection. It is one of the Unani drug. Hajrul Yahud Basma 125 milligram 2 times a day. Yavakshara and Sarjik Shara, Kshara Dvayam, Yavakshara and Sarjik Shara, Shuddha Yavakshara, Shuddha Sarjik Shara if you have soda bicarb. You just add 1/4 teaspoon of Sarjik Shara in the water and ask the patient to drink. Immediately it has got a soothing effect in urinary tract. Within 1 hour patient feels better. Who have excessive sexual intercourse, who have multiple sexual partners, who have more masturbation will also have dysuria. In such a case, it is also cystitis due to E. coli or any other infection. You can think about Shatavaryadigritam. Napumsakatvam with dysuria, Shatavaryadigritam. Dysuria with renal calculi, renal colic, 3 Kantakadigratam. And as a broad spectrum, you can give Annavagraha Prayoga of Vastyamyantaka Gritam. I repeat, Annavagraha Prayoga of Vastyamyantaka Gritam. Sometimes there is a Samanavata Dushti, Pachaka Pitta Dushti, Apana Dushti, Vyanapana Dushti leading to urinary tract disorder like dysuria, Mutra Krichra. Then Vastyamyantaka Grita should be given in between the food. 50% food should be taken, then 1 spoon of Vastyamyantaka Grita with 1 pinch of Saindavalavana and again complete the remaining part of the food. This is called Annavagraha Prayogam. This is also found very effective in cases of unexplained dysuria. Even they have taken antibiotic and patient is not feeling significant improvement. And on urine culture and sensitivity, there is no much understanding is available. Then do this Vastyamyantaka Grita Prayogam. From Sahasra Yogam, it is also a very effective drug. If you want to do Prayoga of Rasa Rasaushadhis, easiest prescription for all dysuria and Mutra Krichra is pain, burning and discomfort in urinary area. Chandraprabhavati, Gokshadadi Gugulu, Gandhaka Rasayana. This makes a very effective prescription. Gandhaka Rasayana, Chandraprabhavati and Gokshadadi Gugulu. Gokshadadi Gugulu alone is also effective in treating this case of dysuria. Gokshura alone can be given in patients who are having excessive sexual intercourse, sexually transmitted illness. Gokshura, Parangi Pattai, Chopachini Churna, Chopachinyadi Churna should be used in sexually transmitted illness. Honeymoon cystitis, or multiple sexual partners getting dysuria. And drugs like Chandrakala Rasa, Chandrakalpas, I call it as Chandrakalpas in Mutra Krichra. Chandrakala Rasa, Chandraprabhavati, Chandraputi Pravala Pasma, Chandanasava. These Chandra based drugs, Chandrakalpas, are definitely going to work. When Pittaja Daha is there, Pittaja Mutra Krichra is there, Pitta Vata Duštijanya Mutra Krichra is there, dysuria due to Pitta Vata Pradhana Lakshanas, Jvara Daha Lakshanas, after the DNC, after the delivery, after the recurrent abortions, after the IVF, IUI, if at all there is a chance of infection, Chandrakala Rasa becomes one of the pioneer drug. Chandrakala Rasa 1 tablet twice a day, Chandraprabhavati 1 tablet twice a day. Chandraprabhavati contains 3 ksharam, 3 lavanam, and Chandraprabhavati, Chandraputi Pravala Basma. Pravala Basma prepared in moon shade is called Chandraputi Pravala Basma. My grandmother used to prepare this some 70 years ago. Chandanasava, Ushirasava, Sarivadhyasava. 3 important formulations are effective. Then Narikela Lavanam. Narikela Lavana is also very good to pacify acidic level in urinary tract disorders. So some of the commercial products like tablet Niri, syrup Niri, Bangshil, Shita Prabha, these are some common urinary drugs which are used in practice. So to summarize, today we have discussed about the dysuria management in OPD level. Dysuria is a nearest clinical condition related to Mutra Krichra. E. coli infection, a gram-negative bacteria, urethritis, human papillomavirus, chlamydia infection, pseudomonas infection, bacterial infection, prostatitis, epididymitis, urethritis, cystitis, renal calculi, urinary tract infections of acute or chronic nature will cause painful micturition, burning micturition, urinary colic, or pain during, before, after micturition, burning before, during, after micturition, discomfort in suprapubic and urinary area before, during, after micturition. Prostate, urethra, urinary bladder are important structure contributing to this. Either acute or chronic infections may be due to simple bacteria or sexually transmitted illness or human papilloma virus. Up to that level, we should investigate if patient is not responding. Interstitial cystitis, overactive bladder syndrome due to anxiety or painful bladder syndrome. Premenopausal, perimenopausal, postmenopausal, low estrogen contents. One who is using more oral contraceptive pills and excessive sexual activity, then he is presented with pain, burning sensation, pain per abdomen, hematuria, increased frequency, fever with rigors or strong smell in the urine. All these will make you to understand dysuria due to urinary infection. If you want to put Ayurvedic antibiotics, Gandhaka Rasayana, Chandraprabhavati, Chiraita and Ativisha, Ilajitu are very important antibiotic-like drugs effective in Ayurveda. Vasthyamayantaka Trikantakadikrutam, Shatavaryadigrutam, Durvagrutam, Dhatrigrutam, Yeladichurnam, Vasthyamayantaka Pashana Bedadi Kashayam, Amritadi Kashayam, Gokshiradi Kashayam, Punarnavadi Kashayam, Punarnavastaka Kashayam, Chandrakala Rasa, Chandraprabhavati, Chandraputi Pravala Basma, Tarakeshwar Rasa. Not Talakeshwara, it is Tara, T-A-R-A, Tarakeshwar Rasa, effective in Muhur Mutra Pravritti, Chandanasava, Godanti and Shwetaparpati. With this, today we come to conclusion of management of dysuria in general practice for the beginners without taking much of the other clinical conditions. Only to the point urinary tract infection and dysuria is discussed. If there are any few doubts, we can discuss. Otherwise, thank you one and all.
Sir, in pregnancy, sir, dysuria. Namaste, sir. Dysuria in pregnancy, drug of choice, sir. Namaste, sir.
urine routine test in first trimester or second trimester, please go through urine test on pelvic ultrasound scan. See that whether it is acute infection or chronic infection, or if it is due to only pregnancy induced, without disturbing much of the pregnancy profile, we can use Sariva as the safest drug, or Ushira. Sariva and Ushira, Amrita Sattva, can be used as a very easy drug. Instead of going to any other drugs, Sariva, Ushira, Chandanasava. 3 asavas there, any one can be given. And see that patient will be getting better Patya. Nari Kela Jalam, Madhudakam, Phalasavam, and giving alkaline fruits is enough to see the hydration is corrected and urethritis or burning micturition in pregnancy is controlled. If at all it is not giving a successful result, even with sometimes modern antibiotics also pregnant women doesn't feel happy, then think about giving Gokshura. Gokshura, Godanti Basma or Hajrul Yahud Basma are also safe in pregnancy. Next step comes is Shatavaryadigrutam, Gokshuram, Trunapanchamula Kashayam can be given.
Sir, Narikela Jala, Madhudaka, and one more you said, sir?
Palasha Pushpasava, Palasava,
Okay.
Triyadishtam, Chandanasava, Ushirasava.
That okay, sir.
Sir, can we use Indukanta Kashaya in pregnancy?
Indukanta Kashaya need not be used in first trimester of pregnancy. For second and third trimester you can use it.
Sir, if it is due to prostate enlargement, BPH, the same medicine, sir?
Same drug.
Along with that, what can we give, sir? Along with that,
If it is Varanadipata is enough, and if you give Basti and Uttara Basti, that will be better.
Prickling in incontinence, sir? Incontinence and prickling.
Incontinence is a different subject where dysuria is not the issue. In stress incontinence or urinary incontinence, where Mutra Sangrahaniya Kashaya, Mutra Sangrahaniya Dravyas like Jambu Phala, Jambasava, Varanadi Kashayam, they can be tried.
It doesn't come under Mutra Pruchra. Okay.
No. Incontinence should be, their frequency is raised, patient is unable to hold, and urine leakage. These are further steps to be diagnosed for atonic bladder, bladder outlet obstructions, neurogenic bladder.
Thank you, sir.
to strengthen, can we give Bastyamantaka Gruta, sir, here?
Yes, that is a Rasayana. Rasayana Prayoga.
Sir, in a 50-year-old female, sir, there's no UTI and no dysuria and the burning sensation, nothing is there, but frequent urination at night.
Okay. On ultrasound scanning, any findings are there to
Normal,
be
sir.
out?
Normal, sir, nothing at all.
Maybe psychological, anxiety, depression. Maybe reason.
Okay, sir.
Anxiety,
Like,
depression.
it's also ruled out, sir.
Anxiety,
Patient says
depression.
she gets to sleep, also she gets only wakes up because of the urine.
That's what I'm
urgency.
telling. These are all anxiety, depression related old age, senile issues, post-menopausal issues. Then Shatavari Siddha Rasayanas, Shatavari Kalpam, Shatavari Kshiram, Shatavari Ghrutam. Shatavari Grutnavagraha Prayogam can be tried in this. Ask the patient to eat food 50%, then give 1 tablespoon of Shatavari Ghrutam mixed with 1 pinch of Lavana and ask the patient to complete the food. If you do this for from 21 days, even though patient is having any such unknown etiology, then that also will be treated.
What about Avapidaka Sneha, sir, in this?
Same, Annavagraha, Avapidaka, Kalpa will be same, Trikantakaadigrita, Vastyamayantakagirta can be used.
Sir, if in urinary thing RBC cells are present, Chandrakala can be given, or sir?
There Durvadigrita is good. Durva Kshirapakam, Durva Siddha Kshiram, Musali Kadiradi Kashayam, Shatavariyadi Kashayam, Bhatyaristam, Shvetapatti, they can be given. Dadimadigrita also choice in such case.
Thank you, sir.
Sir, what is the drug of choice for urinary retention?
That is it is a condition where bladder outlet obstruction is there. It is a Margavarna condition. There you have to do Sthanika Svedanam, Virechanam, Bastihi, followed by drug like Vastimayanta Kagritam. And Chandraprabhavati, Gokshiradi Gopilu can be given in such case. So thank you and all. See you again tomorrow.
Thank you, sir.